Hi guys, and welcome to my first vlog. Well, in today's vlog I'm gonna talk about anabolic steroids. Now, I know it's a wide subject, like everybody's talking about steroids, but here I'm gonna tell you some truth about steroids that you won't find it almost anywhere on the web. Why is that? Because everybody tries to hide the truth about anabolic steroids. So today we're going to talk about anabolic steroids. What are the anabolic steroids? Well, anabolic steroids are a synthetic variation or are synthetic variations of the male sex hormone testosterone. The proper term for these compounds is anabolic androgenic steroids. Now, anabolic refers to muscle building and androgenic refers to increased male sex characteristics. Some common names for anabolic steroids are youre, juice, steroids, and stakers. These are the most common ones. Healthcare providers can prescribe steroids to treat hormonal issues, such as delayed puberty. Now, steroids can also treat diseases that can cause muscle loss, such as cancer and AIDS. But some athletes and bodybuilders abuse these drugs to boost performance or improve their physical appearance. How do people abuse of anabolic steroids, you're going to be asking now. Alright, so people who abuse anabolic steroids usually take them orally or inject them into the muscle. These doses may be 10 to 100 times higher than doses prescribed to treat medical conditions. Steroids are also applied to the skin as a cream, gel, or patch. Now, some athletes and others who abuse steroids believe that they can avoid unwanted side effects or maximize the drug's effects by taking them in ways that include cycling. What does that mean? Well, cycling means taking doses for a period of time, stopping for a time, and then restarting again. Stacking. Now, stacking is combining two or more different types of steroids. And pyramiding. Slowly increasing the dose of frequency of abuse, reaching a peak amount and then gradually tapering off. There is no scientific evidence that any of these drugs reduce the harmful medical consequences of these drugs. Now, you're going to be asking, how does anabolic steroids affect us? Well, here's one affection. Anabolic steroids affect our brain. Anabolic steroids work differently from other drugs of abuse. They do not have the same short-term effects on the brain. The most important difference is that steroids do not trigger rapid increases in the brain chemical dopamine, which causes the high that drives people to abuse other substances. So, this means that you're gonna have a much bigger ego, you will feel more manly, and that will give you a, let's say, cocky appearance. However, long-term steroids abuse can act on some of the brain pathways and chemicals, including dopamine, serotonin, and opioid systems that are affected by other drugs. So this may result in a significant effect on mood and behavior. Of course, taking steroids affects your mood and changes your behavior. Now, what are the short-term effects? Abuse of anabolic steroids may lead to mental problems such as paranoid, and here are talking about extreme unreasonable jealousy, extreme anger, delusions, and here I'm talking about false beliefs or ideas, and impaired judgment. So, as you can see, guys, steroids do affect us, and the steroids are affecting our brain. Now, extreme mood swings can also occur, including roid rage, angry feelings and behavior that might lead to violence. What are the other health effects of anabolic steroids? Aside from mental problems, steroid use commonly causes severe acne. So, taking steroids, you can have severe acne. It also causes the body to swell, especially in the hands and feet. Long-term effects. Well, anabolic steroids may lead to serious, even permanent health problems such as kidney problems or failure, liver damage, enlarged heart, high blood pressure, and changes in blood cholesterol, all of which increase the risk of stroke and heart attack even in young people. Several other effects are gender and age specific. Well, in men, shrinking testicles, decreased sperm count, baldness, development of breasts, increased risk of cancer prostate. Now, in women, growth of facial hair or excess body hair, male pattern baldness, changes in or stop in the menstrual cycle, enlarged clitoris, deepened voice. Now, young kids, I'm talking about teens. Teens can stunt growth when high hormone levels from steroids signal to the body to stop bone growth too early. Stunt height. If teens use steroids before they grow spurt. Some of these physical changes, such as shrinking sex orgasms in men, can add to mental side effects such as mood disorders. Now, are anabolic steroids addictive? Even though anabolic steroids do not cause the same high as other drugs, they can lead to addiction. Studies have shown that animals will self-administer steroids when they have the chance, such as they do with other addictive drugs. People may continue to abuse steroids despite physical problems, high costs to buy the drugs, and negative effects of their relationships. Research has further found that some steroid users turn to other drugs, such as opioids, to reduce sleep problems and irritability caused by steroids. People who abuse steroids may experience withdrawal symptoms when they stop using them, of course, which includes mood swings, fatigues, restlessness, loss of appetite, sleep problems, decreased sex drive, and steroid cravings. One of the most serious withdrawal symptoms is depression, which can sometimes lead to suicide attempts. Now, how can people get treatment for anabolic steroid addiction? Some people seek treatment for anabolic steroid addiction have been behavioral therapy have found that behavioral therapy is one of the most successful treatments. More research is needed to identify the most effective treatment options, but until now, the behavioral therapy was the most helpful. Now, in certain cases of severe addiction, patients have taken medicines to help their symptoms of withdrawal. For example, healthcare providers have prescribed antidepressants to treat depression and pain medicines for headaches and muscles and joint pains. Now, other medicines have been used to help restore the patient's hormonal system. Now, what you need to remember is that anabolic steroids are synthetic variations of the male sex hormone testosterone. Healthcare providers can prescribe steroids to treat various medical conditions, but some athletes and bodybuilders abuse these drugs to boost performance or improve their physical appearance. People who use or abuse anabolic steroids usually take them orally or inject them into the muscle. They are also applied to the skin as a cream, gel, or patch. Some athletes and other people abuse steroids by cycling, stacking, and pyramiding them. Abuse of anabolic steroids may lead to short-term effects such as mental problems. Extreme mood swings can also occur, including roid rage, angry feelings, and behavioral that might lead to violence. Continued steroid abuse can act on some of the brain pathways and chemicals, including dopamine, serotonin, and opioid systems that are affected by other drugs. Now, anabolic steroid abuse may lead to serious long-term, even permanent health problems. Several other effects are gender and age specific. People who inject steroids increase their risk of contracting or transmitting HIV, AIDS, or hepatitis. Even though anabolic steroids do not cause the same high as other drugs, they can lead to addiction. Some people seek treatment for anabolic steroid addiction, and they found helpful the behavioral therapy. In certain cases of severe addiction, patients have received medicines to help treat symptoms of withdrawal. Now, guys, one last thing I forgot to mention. Using anabolic steroids makes your internal organs older. So your internal organs are gonna old or age faster than your outside body. Now, remember this, guys. I don't encourage the use of anabolic steroids. This vlog is only for educational purposes, and I'm making this vlog to open your eyes, guys, because every day I see guys in my gym using gear and they don't realize the risk that they are getting themselves into. Thanks, guys, for listening, and I'll see you guys in the next one. Peace.